Good day. My name is Michael Bender from the Center for Fiscal Equity. This is our comments to both House Budget, Ways and Means, and Finance on the HHS FY 2023 budget. There have been more than a few hearings this spring to set the stage for a release of this budget. I will briefly restate some of our comments. Links to our comments can be found on our Fiscal Equity blog and YouTube channel. These hearings include Senate Finance's behavioral health care when Americans need it from March 30th. Ways and Means, America's mental health care crisis from February 2nd, as well as mental health care in America, addressing root causes, identifying policy solutions from June of last year. Ways and Means, Work and Family Supports, improving family outcomes through home visiting from March. Ways and Means Health, bridging health equity gaps for people with disabilities and chronic conditions. Please also see our many pandemic-related comments, which took the Centers for Disease Control to task for not correctly assessing the early symptoms of the virus. See especially from Ways and Means Health, Path Forward on COVID-19 immunizations from February of last year. We agree with the President's proposals to add funding to prepare for a future pandemic and to fund ARPA-H Cancer Moonshot. Relating to the former will likely help the latter. Part of ARPA-H is the funding for research on orphan drugs and the lingering problem of their costs once research leads to product development. In comments to Senate Finance on March 16th of this year, we repeated our proposal in this area for NIH to retain ownership in any such drug and contract out its further development and manufacture. Keeping ownership in public hands ends the need for drug companies to charge prices or increase prices for its existing formulary to fund development. Pharma would still make reasonable profit, but the government would eat the risk and sometimes reap the rewards. NIH, FDA might even break even in the long term, especially if large volume drugs which were developed with government grants must pay back a share of basic research costs and the profits, as well as regulatory costs. On the pandemic, we urge that there be a public examination of lessons learned, particularly mistakes. The largest mistake was to not identify COVID as being spread like a cold. Subsequent variants identified sneezing and a runny nose as early signs of the virus. This was true in the first round, but to save face, it was not mentioned, and it is still not mentioned. Somebody asked, is it a cold? And somebody or CDC said, no, it's not a cold, and they kept up with that charade. Job one of preparing for the next coronavirus pandemic is to list cold and supposed allergy symptoms as the signal to self-quarantine, if not be quarantined. Donald Trump did not kill 1 million people with the pandemic. Trying to downplay original symptoms did, which led to a loss of credibility among populations. This social aspect must be explored, especially if these populations are to comply with later instructions. In other words, we need to admit failure where failure happened, socially as well as medically. The President's proposals to expand behavioral health are most welcome, although only a start. Replacing mental health facilities as well as policies which allow longer-term mandatory stays are what is needed, including conditions where to a more controlled environment is automatic in the event of relapse on medication non-compliance. That means if you get drunk or you get high, and it's likely to keep going, they lock you up. And if you're out of control, it should be more than just feeling fine to not have a thorough re-examination of your meds. Such changes in the rules of the game will demand 50-state cooperation as local laws are impacted. The Department of Justice and state and local police agency participation is also required. Reform can not only be for those with insurance, it must be for everyone. Parity is not enough and impossible without not only more beds, but more dedicated hospitals. So just changing insurance benefits is not enough. It has to be for everybody. The visiting nurses program is worthy of expansion, not only in public sector funding, but in the private sector as well. So this is the opposite of what needs to happen with visiting nurses. It needs to, with mental health. It needs to also apply to the public as well as just people in the program. When my daughter was born, a visiting nurse to screen for depression and to help with lactation coaching was a godsend. Although we were lucky for generous family leave policies and good health insurance through my wife's employer. Health insurance reform will allow an even greater expansion of the pilot program to all. I will come back to this shortly. New mothers and their partners have unmet needs beyond the particular programs listed in the House Budget Committee summary. We cannot take our eye off of the child tax credit ball. It must be both so families are not simply living off their CTC. The minimum wage needs to go up, although with a higher child tax credit, a lower amount can be agreed to. In other words, you don't need 15 if you have good funding for your kids. Then it doesn't all have to happen on the $15 minimum wage, which is not enough to raise a kid on anyway. Childcare subsidies are now as essential now as they were last year and should be part of, we need to build back better. We have attached a portion of our comments from last year having to do with the Affordable Care Act from last year's HHS budget, enacting a public option, how the issue is related to student loan forgiveness. Here's a clue, baselines, and how to reform Medicaid and Medicare to remove the biggest Medicaid contingent liability from state budgets. Considering the problems getting Build Back Better over the line, I can see where opening discussions on the public option of Medicare for all might prove difficult, especially given the lack of agreement between the relevant committees. In other words, we have people who want Medicare for all or bust, and then people who want to go with the president's plan. I hope I am not shocking anyone by saying this. With that said, it is time for both CMMS and the Budget and Revenue Committees to start discussing what might be done in the next Congress on a bipartisan basis. Please allow me to offer questions for research and discussion. Okay, would a public option be more likely to pass if Affordable Care Act surtaxes, SMI, were repealed? What would be the impact on passage and operation of a public option of ending pre-existing condition reforms with automatic enrollment in the public option with subsidies if coverage were denied? How large would subsidies be to have to be to hold those who cannot get insurance due to a pre-existing condition harmless? In other words, holding them harmless from being covered like they would be proposed to be covered in private insurance. Are Affordable Care Act deductibles and premiums too high? It seemed so to me when I had them and suffered a broken rib for which the provider was never paid because it was too high of a copay, and I should have stayed on Medicaid anyway, but I didn't know that, and nobody talked me out of it. Can a public option or even the ACA as it exists meet all of its goals without either immigration reform or ending the prohibition on covering undocumented workers? To what extent is sick leave, Building Back Better, essential for the ACA to really cut prices? To what extent would the public option replace Medicaid? Would reform be easier to pass if long-term care were funded as Medicare Part E rather than being operated and funded by the states? This would also require 50-state cooperation to study. I think they would say yes, though. What is the best way to fund a public option or Medicare for all? Is some form of border adjustable goods and services tax better than a payroll tax? Would an employer paid subtraction VAT be better? The subtraction VAT would burden profits and would replace current funding of the Affordable Care Act and the tax exclusion for employer-provided health insurance. Corporate income taxes in Schedule C and F for Form 1040 would also be replaced with this tax, the subtraction VAT. See the second attachment for details, which will be the tax reform attachment. So how long would it take for insurance companies to deny anyone who is sick coverage, thus forcing them into a subsidized public option? Would this become Medicare for all? Much private managed care, Medicaid, and Medicare's Parts B and D, and Part C are all offered by the same list of providers, albeit with different copays. Income security is also in need of advanced study. While Social Security 2100 is the school solution preferred by most mainstream analysts, should some form of expanded employee ownership be part of the solution? To study this, HHS, the IRS, and the Department of Labor, as well as the authorizing committees, should look at how to expand employee ownership. The same bodies must also explore the impact of increasing the minimum wage on benefit levels, assuming that any increase would lead to a rebasing of employment history. What is the impact of crediting the employer contribution on an equal dollar basis rather than as a match for the employer contribution? Would rebasing income history with a higher minimum wage and an equal dollar employer contribution empower low income, elderly, and disabled? Is it a matter of degree? How much would the minimum wage have to change to make a significant impact? And how would addressing such questions impact Social Security 2100? Could you do both, or would you have to even do 2100? These are the questions that should be discussed, even though they're not, actively mentioned in at least the schools, the committee presentation of the president's budget. And I'm pretty sure they're not in there. But it's malpractice to not talk about these things and to not fund this study. So hopefully the appropriations language will include a study with these questions. And I am, of course, available to help form the questions and discuss them. The information's in the chat, not the chat, the description. So please contact me if I can be of any service at all, or can testify on my own if there be such a hearing on public employee reaction to the HHS budget. Have a pleasant day.